In this video, I'm going to answer a question I got about chronically high EBV IGM antibodies. If you're struggling with mono, chronic Epstein-Barr, or just ongoing fatigue, this video might be of interest to you. We're going to look at what the typical time frame is for Epstein-Barr IgM antibodies getting cleared out of your body and some of the nuances of what testing and symptoms can tell you about what's going on with that virus. So if you like this kind of information on nutrition, health, just trying to get a better understanding of what's going on with your body and your health, click on the like button and subscribe to the channel so you can get more videos like this one. Now for a quick disclaimer. The information contained in this video is for informational purposes only. It is not intended as a treatment for any health condition or as a substitute for seeing an actual doctor or medical professional. It should be used as an educational guide to deepen your understanding of health and treatment success. If you need medical attention, don't delay in seeking that treatment. All right, let's look at the situation with chronically high EBV IgM antibodies. So this video is about chronically high EBV IgM antibody levels. So EBV standing for Epstein-Barr virus. The idea for this video came from a question I got, which stated that I had mono 4 months ago and just got the blood results back, and I still test positive for IgM antibodies, which have actually increased. So the question is kind of implied there. What does this mean, or what should I do about this? So when you have elevated or high EBV IgM antibodies, it's a sign of an acute Epstein-Barr infection, number one. Number two, a reactivation of the Epstein-Barr virus. So it was dormant and then it's coming back. Or three, the lingering antibodies from the acute infection. After the infection's kind of fading, the antibodies can linger for a couple months after your body's already starting to overcome the virus. Typically, the IgM antibodies will stay high for a few months after the infection. 4 months is sort of getting on the long end of that. And the fact that they increased, does suggest that this may be going on longer than what we typically would see. But still, the numbers can change within another week or two. Numbers can be on their way down. Now, in a situation like this, your symptoms can really be helpful in understanding what's going on with the virus and what the virus is doing and how your body is handling that. So if you continue to have things like fever, swollen lymph nodes in different parts of your body or in your neck, enlarged spleen, which you'd have to get an image for that, severe fatigue, like hard to get out of bed, hard to really do anything. Symptoms like that suggest that your body is still fighting off this virus, and the virus is still quite active in your system. If you're more on the asymptomatic side, then or just gradually getting better and better, then it's more of an indicator that the virus is on its way out, and these are just lingering antibodies in your system. Sometimes there could be in-between phases where you are getting better, but it's lingering longer than it should or typically does. Typically, a viral infection like from Epstein-Barr or mono will linger for about a month or two symptom-wise, and then things will start to get better. Some people get over it in weeks, and some people never even have acute infection from it. So there's a wide variety of responses to it. Partially that could be coming from the person's genetics, could be coming from the genetics of the virus and the virulency of the virus itself. We really don't know at this point why some people tend to respond that way and why sometimes the virus reactivates in your system. Sometimes those IgM antibodies can stay high for 6 months, 12 months, or even several years. And that's usually a sign, when it starts to go longer than the 6 month, that you do have chronic Epstein-Barr virus. Remember that the Epstein-Barr virus, or mono, is a herpes virus. And so that once you're exposed to it, those types of viruses will always live in your body, and you're always going to have an IgG positive blood test when you get that blood test done. It's the IgM that typically will turn negative within 2 to 4 months. And with that, you got to give a margin of error by a few weeks or even a full month, just because everyone's somewhat different in how they're going to respond. Diagnosis of chronic Epstein-Barr is far from black and white. You have to use a combination of lab testing, like I've mentioned in other videos, the symptoms that you currently have going on, which may be waxing and waning, ruling out other things that could account for these symptoms, and the long-term overall clinical picture. It should give you a better understanding of what to do with chronically high EBV IgM antibodies. There's lots of testing and antibodies to track when you have this problem going on, and it probably would be helpful to check out some of my other videos on that where I go into more detail. If you do have follow-up questions about the IgM situation and chronic Epstein-Barr virus infection, drop it in the comment section. I may do a separate video on that. I'll definitely try and answer your question. Thanks again for watching. We'll see you next time.